Are you bored, Brittany?
Yes.
Dr. Brittany? Do you want to come and see a patient? Come on.
I'd love to.
All right. Is she really just sitting back here throwing that foot around?
Yeah, I think she's bored.
She's ready to see patients?
Yeah, she's really ready to see him.
Okay, wait till she sees this one. This guy has a hole in his foot. You're not going to believe this. Hey, everybody. Oh, the patient just said smile.
Smile.
Look
Hi,
who
guys.
we have.
This
Who do we
is Dr.
got?
Steinkar with Healthy View Podiatry. So today we have a patient who has a chronic ulceration. He underwent treatment with IV antibiotics for 6 weeks. The ulcer is making progress, so we're here today just to debride the wound and clean up and see how it looks.
So we'll zoom in on it. I'm the cameraman. This is Dr. Krawitz in the background. I know you guys really want to see me and hear me talk.
He looks good all the time.
So the patient says I look good all the time. Well, that's good to hear. All right, so I'm going to zoom in on this too. This is actually pretty
Is that
cool.
looking normal, hopefully?
I'm actually not as good at filming as Alexia is. So
right now
Dr.
we're just
Brittany,
taking
we
all
call her
this-
Dr. Skunk. You like Dr. Skunk or Dr. Brittany? Better?
Whatever.
All right, what's your stage name going to be, Dr. Brittany?
That's fine.
All right. But anyway, what she's going to do, we've been debriding this every couple of weeks. And this patient, we won't say his name, has been coming in every couple of weeks. He had osteomyelitis, so he had a bone infection at the tip of the toe. And he had 6 weeks of IV antibiotics. I'm going to get here. If I get too close, just let me know that I'm in your face here. And I'll, zoom in here. And on x-ray, when we looked at the x-ray 2 weeks ago, it looked like the bone was still eating away, if I remember right. Is that right?
Yes,
Brittany?
yeah.
Okay. So it's still bad, but our patient, who's diabetic, and we're right in the middle of a pandemic, absolutely does not want surgery at this point. So we're doing the most conservative route. He had 6 weeks of IV antibiotics. He's now taking oral antibiotics. And what we have him on penetrates into the bone. It's clindamycin. It has really good bone penetration. Is that correct, Dr.
Yes.
Brittany? That's what I learned way back when. But we do know that it has good bone penetration. So it's a good follow-up antibiotic to use. We're just going to watch it, and we're going to take sequential x-rays every couple of weeks. So probably 2 weeks from now, we'll take x-rays again. Nothing's really going to change because he doesn't want surgery at this point, but you're going to see that this hole is pretty deep. Yeah. And we can actually probe towards the bone, and we'll probe it in a little bit. Do you need any 4x4s or anything like that?
Yeah.
You know what, though? I'm going to have you get it because I don't have my gloves on. I'm just the camera guy.
And look out for your shoelace, too.
Yeah, I see it. Yeah, thanks. Yeah, my shoes are untied. Oh my gosh, look at that. But they're yellow and they look clean. I just cleaned them. Look at that. Nobody really wants to see my shoe. Let's go back to the ulcer.
So here you guys can see it's pretty deep, and we are feeling some bone at the tip there. Like we said on x-ray, the bone itself is whittling away because it was infected. That's about how deep it goes.
And our patient really can't feel that at all.
Right.
He's neuropathic. He doesn't have any feeling, and the neuropathic means no feeling. Diabetics get that. And you can literally be pushing on the bone, which would really hurt in a normal, non-neuropathic person. Not that our patient's abnormal. He's very normal. He's the most normal guy I've ever met, actually. But when you're not neuropathic, it would hurt pretty badly.
So what do you think, Dr. Leo's?
I think it is. So I think that still has a bone infection probably. So we assume when a patient has palpable bone, when we can take a probe and probe down the bone, it's assumed that they have osteomyelitis. So we're going to keep treating them with antibiotics. As far as the debridement goes, it's up to you, Brittany, how far you want to go. I wouldn't get that much more aggressive. I would just get more of the hyperkeratotic tissue around the edges. That's what I personally like to do. Everyone has their own way of debriding, but the key thing is just making it bleed. When it bleeds, when we debride it and it bleeds, it actually stimulates more wound healing and granulation to form a granulation tissue. What we want is it to form over the bone, and hopefully there's no infection, and it can heal over and fill in. But every time he comes in 2 weeks, we're cutting more off. But I have to say, it does look better.
Definitely.
It looks better,
I wanted
but
to hear from you.
Yeah, it looks better when we look at it. But on an x-ray, the bone is gone. You lost some bone. It may or may not come back. It doesn't matter. The bacteria ate it away, but if you heal around it and there's no bacteria left in there, then you'll be fine. But if there is, it's called chronic osteomyelitis. It can just sit and fester, and then it can just blow up one day where the bacteria start to
Well, that's why I'll always see you every 2 or 3 or 4
That's
weeks.
exactly right, until we get it stable or we know it's stable. So this is what it looks like straight on. All right, we're gonna
Where
get the
YouTube
zoom.
might crash.
Yes, this is the cool view.
YouTube might crash.
Extreme close up of the ulcer. Let's get see how close we can get. Look at that. That's the center of the ulcer. And you know what? That actually looks really good. The granulation tissue is in the center. That's nail that you see at the tip. You know what, Brittany? I don't know if you want to clip just at the end of that nail. Yeah. It totally. And then we have a lot of OCD people that watch this. That they're going to freak out if we leave that nail that long.
Can we get any kind of revenue stream off this?
Sure. Yeah. We'll send you checks.
You don't see all I get is
Donations.
bills.
We'll start a GoFundMe page.
No, we're good. We're good. But thank you for the offer.
We'll call it Tom's Toe, even though your name's not Tom. No, we won't do that. We won't do a GoFundMe page. But
So the nail's growing back somewhere because I know we took it off a few months ago.
yeah,
Yeah,
it
the
doesn't
nail's
matter.
back.
It's callus and nail is what
Oh,
it
I
is.
got you.
I'm gonna try to go extreme, like above here, so we can see. There we go. And all we're doing here is, I'm over your shoulder. Sorry, I know this is annoying as can be. It's just make it look like it's straight and cleaned off of there. Oh. I'm terrible at filming, and I know there's gonna be a ton of comments. You're filming, it's horrible. Go back to treating patients. Yeah.
No,
That looks really good.
she doesn't look
Dr.
bad.
Brittany did a fantastic job with this. All right, up. Round of applause.
Bravo,
Number one
fan.
fan,
Yeah,
you know,
number
what
one
can I
fan.
say?
Right, exactly.
Right, sorry,
All
Dr.
right.
Leo. Just gonna get
So she's dressing it up. Now, I flipped this around on myself, but it makes my head look too big and too fat. Let's see if I can flip this around.
She's a much better model than
No, I
me.
think she looks a lot better. Yeah, we'll just keep Dr. Brittany on there for a
Oh
minute.
gosh. You okay with purple?
You're in charge.
When she takes her gloves
Oh,
off, she
that's
can.
nice, Brittany.
Alright.
Yep, there it is. There's the dressing. So what do you think?
She's good.
All good. So, patient's gonna come back when?
Let's have them back in 2 to 3 weeks. We'll check it up at that point and divide some more tissue.
Okay.
Okay?
Yeah.
So that's what we do. We'll clean it off in a couple
Brittany,
weeks.
2 or 3, it's up to you.
Let's do 3. We've been doing 3 every 3 weeks.